My name is Amy Pierre. I am a senior clinical director at Flatiron Health, where I specialize in real world evidence and real world solutions on hematologic malignancies. And I'm also a nurse practitioner at Memorial Sloan-Kettering Cancer Center, where I see patients who have multiple myeloma and lymphoma. So, Blood Cancer Awareness Month is near and dear to my heart. And of course, being in the profession of advanced practitioners and nursing, I also have lots of thoughts about that. So, you know, I believe that nursing and advanced practice are not just careers, I think they're callings, particularly in the field of oncology. I feel that, supporting patients through their cancer journey is really an act of deep empathy and even clinical excellence. It's a role that requires constant commitment to learning and growth. And as I've mentored nurses and advanced practitioners over the years, I would have to say that my first piece of advice is staying, relentlessly curious. Oncology is a rapidly evolving field, particularly hematology. And with new treatments, new targeted therapies, research emerging every day, the best nurses and APPs are not just practitioners, they're lifelong learners, right? Who view every patient interaction as an opportunity to understand, an opportunity to apply new knowledge and to innovate. And so this curiosity is what really fuels a higher standard of care and keeps us at the cutting edge. I would encourage them to embrace the complexity of blood cancer. So don't be intimidated by the science, but rather let it, fuel your desire to understand more deeply, read the latest research, attend conferences, seek out mentors who can challenge your thinking. And I think another piece of advice I would have is, uh, never lose sight of the patient's humanity. So in the midst of complex protocols, challenging logistics, it's really easy to become focused on the disease itself. But our true purpose is to care for the person, right? So the cancer journey is a profound and often terrifying experience for our patients and their families. So our role really is to be that steady, knowledgeable, and compassionate presence, help navigate not just the medical side of care, but also, the emotional, social, and spiritual aspects as well. And quality care is a twofold commitment. It's excellence in clinical practice, profound empathy. You can have all the knowledge in the world, but without empathy, you cannot truly support a patient through their most difficult moments. And then lastly, I would say my final piece of advice is to find your specialty and cultivate your craft. So advanced practice in oncology is about deep specialization. It's about taking ownership of a particular patient population, a disease type, becoming that true expert. Hematology is complex. So this specialization allows us to deliver, really incredibly precise care. And it's also crucial to see yourself as part of a multidisciplinary team. We can't do it without the help of our physicians, our pharmacists, our social workers, other nurses, etc. So collaborative practice is not just a nice to have, it's really the foundation of excellent oncology care. I'm very passionate about improving the experience of multiple myeloma patients, and I serve on the Nurse Leadership Board for the International Myeloma Foundation, which is a privilege and an honor. I've been on that board for 7 years now. And, over the last 2 years, I have found myself in the role of becoming a caregiver or a care partner for loved ones in my family who have experienced a diagnosis of cancer. So now I've been on that other side of the table, being sort of deep in the cancer journey as a loved one with cancer. And so I've really become fiercely involved in enriching the lives of care partners who are taking care of loved ones going through their oncology journey. So with the Nurse Leadership Board, we've created tools, lots of education to equip the multiple myeloma care partner as they navigate the myeloma journey, and are planning to launch more material this year for care partners. And then my passion for research in understanding health inequities in patients with heme malignancies continues, of course. So our health equity research lab here at Flatiron, we've done a lot of innovative work in exploring these concepts, and we look forward to having more opportunities to present this work in upcoming major conferences over the next year. And additionally, one thing we're working on globally as a company is to deliver what we call global evidence solutions. So we want to continue our work in sort of a multinational way, looking at multinational data, because we really feel that reflects the priorities of the healthcare system's need to understand real world oncology care and outcomes across geographies. So I'm continuing my work on understanding health inequities, not just in the US, but also globally. I would have to say that hematologic malignancies, as I said before, are very complex and they're essentially rare. So I definitely encourage nurses, advanced practitioners to hone their craft. Don't be afraid to specialize. Patients want to see experts in what they're personally experiencing. So do not be afraid to dive into that research and learn more and become the expert in your clinic of about one particular aspect of disease that really makes you shine and shows the value of the care that you bring to your practice.